Hey St. Louis, I'm Dr. Fred Echols, Acting Director of Health for the City of St. Louis. Many schools are returning to in-person learning for the 2021-22 school year. The City of St. Louis Department of Health has received questions from residents relating to a healthy return to school. This week's questions and answers highlight some of the return to school issues that are on the mind of residents. Jennifer from zip code 63147 asks, over the years, why have certain vaccinations been required to attend school? Mandated school vaccinations help minimize the risk from vaccine-preventable diseases. These requirements help safeguard children and adolescents by making sure they are protected when they get to school, where potential for vaccine-preventable disease transmission is higher. Missouri law provides that all students must present documentation of up-to-date immunization status, including month, day, and year of each immunization before attending school. There are exceptions for students whose immunizations are in progress, which means a student has begun the vaccination process and has an appointment for the next dose. Religious and medical exemptions are also permitted. The appropriate exemption card must be on file, and unvaccinated children are subject to exclusion from school when outbreaks of vaccine-preventable diseases occur. Princeton from zip code 63107 asks, should my son get a physical examination before returning to school? The City of St. Louis Department of Health recommends children receive an annual physical examination before returning to school after their summer break. A lot can change in a child's or teen's health within a year's time. By scheduling an annual physical, you are able to monitor the growth, health, and development of your child in addition to safeguarding against potential physical problems that could arise. During your child's annual physical exam, special attention is focused on whether they are meeting normal developmental milestones. According to the Centers for Disease Control and Prevention, your child's yearly exam ensures that they are up to date on vaccines to protect against serious diseases. Safeguarding your child's health as well as the health of classmates, friends, and others in your community is a top priority for doctors and school administrators. It's best to prepare your child for their exam by providing them with an overview of what will take place. Go over what to expect, such as how the doctor will be checking their eyes, nose, ears, and weight. Gwendolyn from zip code 63115 asks, why does the Department of Health recommend sleep schedules for school-aged children? Adequate sleep contributes to the student's overall health and well-being. Students should get the proper amount of sleep at night to help stay focused, improve concentration, and improve academic performance. Children and adolescents who do not get enough sleep have a higher risk of many health problems, including obesity, type 2 diabetes, poor mental health, and injuries. They're also more likely to have attention and behavioral problems, which can contribute to poor academic performance in school. The Centers for Disease Control and Prevention recommends students 6 to 12 years old receive 9 to 12 hours of sleep in a 24-hour period. It is recommended that students 13 years of age and older receive 8 to 10 hours of sleep in a 24-hour period. The City of St. Louis Department of Health recommends parents and guardians model and encourage habits that help promote healthy sleep practices. Setting a regular bedtime and rise time, including on weekends, is recommended for everyone, children, adolescents, and adults alike. Lisa from zip code 63110 asks, is it true that this school year all students will be required to wear masks? The City of St. Louis Department of Health joins the Centers for Disease Control and Prevention and the American Academy of Pediatrics in recommending universal indoor masking for all teachers, staff, students, and visitors to K-12 schools, regardless of vaccination status. COVID-19 prevention strategies remain critical to protect people, including students, teachers, and staff who are not fully vaccinated, especially in areas like St. Louis where there are moderate to high community transmission levels. Many schools serve children under the age of 12 who are not eligible for vaccination at this time. Therefore, public health guidance to schools emphasize implementing layered prevention to protect people who are not fully vaccinated, including students, teachers, staff, and other members of their households. In addition to face coverings, social distancing, testing, proper ventilation, routine hand washing, stand home when sick, contact tracing in combination with quarantine and isolation, and cleaning and disinfection are also important layers of prevention schools will be using to keep learning environments safe. In addition, the City of St. Louis Department of Health also recommends that all school systems in the City of St. Louis enroll in a federal program that will make COVID-19 testing available for staff and students at no cost. Testing will be essential to keeping schools open throughout the school year. Thank you so much for tuning in this week, and thank you to Jennifer, Princeton, Gwendolyn, and Lisa for submitting questions this week. I look forward to joining you next week for more critical public health information. Let me hear from you, St. Louis. Please send your questions to health@stlouis-mo.gov. Questions will be answered in the order they are received. If I run out of time on air, your question will be answered by return email. Be well, St. Louis.